All right, continuing with 9.PCH.3.2 content. This is CPR and first aid for choking and victims going into shock. So this is the second of the third PowerPoint we're going to go over. So we'll go ahead and start with that now. So this CPR and first aid for choking is going to be medical emergencies that are life-threatening, include loss of breathing, shock, and choking. The vocabulary this time is chain of survival, a defibrillator, cardiopulmonary resuscitation, which is CPR, rescue breathing, and shock. So the first few minutes in a medical crisis are a lot of times the most critical, so it is very important that we get started with this chain of survival. We get started with the steps to CPR and initiate everything. So if the victim is unresponsive, or unable to speak or react to their surroundings, you have to act quickly. So the key for you is to remain calm and take action. So if they're unresponsive, in immediate danger, your best hope lies in the chain of survival, and that is the sequence of actions that maximize the victim's chance of survival. The chain of survival is to call emergency medical services, start CPR, use a defibrillator, and then advance care once medical help has arrived. So the first step is important for all victims, and of course, call 911. The 911 operator is going to ask you questions about the victim's conditions, how to instruct you what to do if you were unsure, and talk to you the entire time until professional help arrives. If the victim's heart is stopped, you're going to be instructed to move to the next link, and that is conduct cardiopulmonary resuscitation, which is known as CPR. And and along with CPR, if there's an AED machine, you're going to want to use a defibrillator. And a defibrillator is the next chain, and that is a device that delivers an electric shock to the heart and restores it to normal rhythm. Of course, now in a lot of public places, AED machines are available. Like, for example, at school, there's one here in the gym, there's one in the front office. And of course, those of you that play sports, our athletic trainer has one that she brings to games, takes out to the football field for practice, so in case the emergency arises. And of course, paramedics and other trained medical professionals can provide advanced care needed to keep the victim alive on the way to the hospital. So you have done your job by calling 911, starting CPR, using the defibrillator until paramedics and EMS workers can come to the scene. Of course, you want to give CPR as soon as possible, which to get oxygen and to get breath into the victim who is not breathing. However, if no trained person is present, it's better to have CPR done by an untrained person than to wait for someone. And of course, it is a first aid procedure that combines rescue breathing and chest compressions to supply oxygen to the body until normal body functions can resume. Y'all, if you are uncomfortable with giving rescue breaths to either this complete stranger or this person that has all of a sudden needed the emergency, or fallen victim to being unconscious, at least do chest compressions. They say now that just doing the chest compressions can save somebody's life. You do not have to always do rescue breaths. So CPR for an adult. So before performing CPR, check the scene to see if the person is conscious. Tap the victim on the shoulder while shouting, "Are you okay?" If the victim doesn't respond, start the chain of survival by calling 911 and then begin performing the steps of CPR. Of course, CPR involves rescue breathing, and that's breathing for a person who is not breathing on his or her own. But once again, if you are uncomfortable giving those rescue breaths, at least do the chest compressions. The basic cycle for CPR is alternates between 2 rescue breaths and 30 chest compressions. You're going to check what the victim is breathing. You're going to look, listen, and feel for normal breathing for 5 to 10 seconds. And then signs of normal breathing include seeing if the person's chest rises and falls, hearing breathing sounds including wheezing, gurgling, or snoring, or feeling the air being moved out of the person's mouth or nose. And of course, if you cannot detect signs of breathing, that is when you begin the rescue breathing and the chest compressions. So you want to tilt the victim's chin upward and to open the airway, pinch the victim's nose, and shut your thumb or forefinger. And of course, have a sterile breathing mask available and place it over the victim's mouth and nose. And then take a breath and place your mouth over the opening of the mask. If you do not have a mask, take a breath and place your mouth over the victim's mouth, forming a tight seal. Like I said, but if you are you do not have a mask and you are uncomfortable doing mouth to mouth without one, at least do chest compressions. And of course, watch to see the victim's chest rise, and then remove your mouth from the person's mouth to take another breath and allow the victim's chest to fall, and then begin the chest compressions. And to give chest compressions, position your fingers to find the end of the victim's sternum where ribs come together. Place 2 fingers over the end of the sternum, and of course place the heel of your other hand against the sternum directly above your fingers, and then place your hand on top of one, just so you put just in the position, and interlock your fingers and hands and raise your fingers so they do not touch the person's chest. And of course, straighten your arms and lock your elbows, and then line your shoulders up so they directly above your hands, and then press downward on a person's chest, forcing the breastbone down about 1.5 to 2 inches, and then begin compressions at a steady pace. You can maintain a rhythm by counting 1 and 2 and 3 and press down each time you say a number. After performing 30 chest compressions, then give 2 more rescue breaths and begin repeating the cycle. And you're going to repeat this 2 breaths and 30 compressions until medical help arrives, medical professionals arrive, or you have someone else to relieve you in the meantime. But do not stop CPR. Of course, if the victim is an infant or a young child, the cycle is still 30 chest compressions to every 2 breaths, but the procedure for chest compressions is a little bit different. For infants and children, of course, check to see if the child is breathing before calling 911. If the child is not breathing, give 5 cycles of CPR, or about 2 minutes worth, before making the call, especially if you are the only one there. Now, if you have someone else with you to provide help, they can be calling while you are doing CPR. And of course, perform rescue breathing on a baby. Place your mouth over the baby's nose and mouth at the same time, not just the mouth only as an adult. And use a face mask do not use a face mask designed for adult CPR when performing CPR on an infant. And of course, to perform chest compressions with an infant, just put 2 fingers on the baby's sternum and press down about 1/3 to 1/2 the depth of the baby's chest. And to perform chest compressions on a child between 1 and 8, you can either use the heel of one hand or use both hands depending on how big the child is. And position your hands about 2 fingers widths above the end of the sternum and press the sternum down about 1/3 to 1/2 the depth of the child's chest. And of course, so this is pictures for CPR in infant and a child. You're going to position their head the same way you would for an adult. As you can see on the picture on the left, it is an infant. They just have their 2 fingers, and then on the child, they have just 1 hand. And of course, this is for choking, choking and shock or life-threatening emergencies as well that require immediate attention. And you need to know these steps as well. So the chain of survival does not apply, of course, to every medical emergency. So if a person is choking, for example, rescue breathing is not going to help because the airway is blocked. So when someone is choking, and they choke on a piece of food and it becomes stuck in their windpipe, that cuts off their airflow. So clutching their throat is a universal sign of choking. Other signs of choking include the inability to speak, difficulty breathing, an inability to cough forcefully, turning blue at the face or lips, or loss of consciousness. And of course, if you see the signs of choking in an adult, help that a person immediately by performing abdominal thrust. If this choking infant, give them back blows and chest thrusts to dislodge the object. Of course, here you can see the picture. You're going to stand behind the victim and wrap your arms around his or her waist. Of course, if for a pregnant and obese victim, wrap your arms around their rib cage. Of course, make a fist with one hand and grasp it with the other hand, and then pull your hands into the abdomen in a quick upward thrust. And you're going to repeat that abdominal thrust until the object is dislodged. And then if the infant is choking, you're going to hold the baby face down in your forearm, which should be resting on your thigh, and with the heel of your hand, give the infant 5 gentle, firm blows between the shoulder blades. If this doesn't dislodge the object, turn the infant face up with their head lower than their body. Perform 5 chest compressions as you would be performing CPR. If the baby still isn't breathing, have one call emergency services immediately and repeat the back blows and chest thrusts. If breathing doesn't resume, then begin infant CPR. If someone goes into shock, call 911 right away. And that is a life-threatening condition in which the heart does not deliver the adequate supply of blood throughout the body. Symptoms of shock include cold, clammy skin, which may appear pale and grayish, weak, rapid pulse, altering in breathing, dull, staring eyes, which may have dilated pupils, and faintness, weakness, and confusion or loss of consciousness. Of course, get the shock victim to lie down or raise legs about 12 inches if he is conscious and doesn't have an injury to the head, neck, or spine. And if the victim has any wounds or other injuries, give first aid to those injuries while you wait for help. Of course, some shock victims become anxious and agitated, so try to keep them calm. Monitor their breathing and be prepared to start CPR if they do stop breathing. Of course, loosen the victim's clothing to keep them warm and comfortable, and don't give the victim anything to eat or drink if they are going into shock. And of course, if they vomit, drool, or start bleeding from the mouth, roll them in the recovery position on their side. That covers the first aid and CPR portion of the PowerPoint. We do have one more PowerPoint to review, so of course review the next video for the third and final PowerPoint.